Well, and speaking of alternative medicine, there's a man, he's known as the Pain Whisperer, who has used his kung fu and acupuncture background to devise a unique treatment plan. This is for pain primarily. His patients rave about the relief they've experienced. We sent this guy, Dr. Orton, to meet the Pain Whisperer to see if he could help our favorite ENT.
Well, I've been pretty much struggling with this right knee pain now for about a year. I had this accident a year ago. I tore my medial meniscus. I think you can barely still see the scope marks. But the pain is on the inner part of my knee where it's bone on bone. I heard the Pain Whisperer was coming to town. Decided to give it a shot. You must be Tom. Good to see you. Now the Pain Whisperer is actually sitting in my office. How did you get that title?
I was treating someone, and I've done tens of thousands of treatments, and the woman jumped up off the table, and she said, "Oh my God, I can't believe it. You must be some kind of pain whisperer." And it kind of stuck. I used this Kung Fu training to super sensitize my hands, and when I touch the tissue, I'm able to do a different type of diagnostic because I can see in the tissue pretty much as well as I can see the details around the room, like looking at the pictures and all. It's just very, very detailed. With that, I'm able to then reprocess the tissues and make them normal.
What do you say we do it?
You ready?
I've been ready.
You ready? All right. All right, let's see what we got here. So I can feel some tightness in there that no doubt you feel too.
I'm feeling some pain there. He has found the spot.
I'm just going to rotate a little bit here. You have a very specific cartilage problem, and hopefully by rebalancing this, you're going to join all of those who got better. Okay, let me take a look here. Keep breathing, nice and easy. Can you feel that it's not just me digging, it's me feeling something very specific each time? Feeling pain?
Yeah.
Oh, positive again.
You touch it.
Yeah.
Found the motherlode.
Please welcome pain specialist and licensed acupuncturist Tom Chi to the show. How did you come up with this idea of combining these different therapies when it comes to soft tissue injuries?
I just took these esoteric Kung Fu exercises. I increased my sensitivity so I see as well with my fingers as I do looking around this room. But what it comes down to is being able to feel it with such detail that I know where the injury is and I know when it's gone.
So, you know, we want to know what's the verdict here. We're clearly, I mean, I still have the pain inside my knee, but I am walking, I am running much better. You saw me in that clip limping.
All right.
Okay, that's enough, Drew.
I wasn't able to jog, and part of that, I think, is loosening it up.
Well,
You're a great sport.
Do you also not only see that people will have an injury, and then to compensate for that injury, Drew's been limping for a year. And when you're limping, all of a sudden everything's asymmetrical. So you're probably finding all sorts of ancillary areas of soft tissue.
There's all kinds of stuff we can do.
Tom, thank you so much for coming on the show.
My pleasure. Thank you for having me.